Game over. It is game over.
Game over, cancer. I'm Val Solomon, Director of Program Impact at Cannonball Kids Cancer Foundation.
And I'm Dana Nichols, Executive Director of CKC.
Game Over Cancer, a podcast dedicated to exploring conversations about pediatric cancer research, solutions, and inspiring family stories.
We're a nonprofit dedicated to creating innovative treatment options for kids fighting cancer and educating for change.
By creating a space for these conversations, we empower the community to take action and provide tangible hope.
Game over, cancer. Screw you, cancer. We are excited. Our guest today is a clinical psychologist at AdventHealth Orlando and provides counseling and testing services in the outpatient clinic. She works with elementary age children through young adults, many of whom have been treated for cancer. She's over at the AHMG Pediatric Neuropsychology Clinic with AdventHealth Orlando. Please welcome Dr. Carrasco. Good morning.
Good morning. Thank you so much for having me today.
Thanks for being here.
Thank you for being here. Well, we love the opportunity to tell so many different stories that come with childhood cancer, but certainly ones we don't often see. And when we were meeting with you, we thought, what a beautiful part of a really hard journey that our families are on. So we thought maybe we'd just start with, can you tell us about your role in a family's cancer journey?
Sure. So what we provide here at the clinic is outpatient counseling. So typically we see individuals who are not inpatient. So if anyone is currently receiving treatment, surgery, things like that, we typically see them after that, sometimes before. But with my role and my experience, I've typically seen families, children, adolescents, and even young adults after their treatment or when they're kind of towards the tail end of their treatment.
So very much when we talk about what our families have told us about their cancer journey is there is life before cancer and there's life after cancer. We're talking about the life after cancer piece where they can kind of lean on you for a little bit of support. Awesome. Can you talk about what kind of support you offer families? What kind of things do they typically need when they come in and get your services?
Sure. Usually families come in for an array of concerns, just like, the typical population or our regular community. So there's a lot of adjustment that comes with this because it is a really big change. I like to talk to families about how all change can be stressful, even if it's positive or negative. Anyways, ending a treatment journey, there's a lot of complicated feelings there because there's some positive and there's some negative too. I would say one of the biggest things that we see is the transition in roles. So essentially you go from a patient role, someone who's going, has been in a sick role for quite some time, into a survivor role or trying to explore just being a regular kid, just being a regular adolescent, just being an adult. That's a lot to handle. And oftentimes there's a lot of expectations that come with that, a lot of new responsibilities that come with that.
Yeah.
A lot of adjusting to new things, if that makes sense.
Yeah, it does. I think we hear that from our parents and young adult survivors where, the idea of not having a scanxiety is absolutely a thing and having to wait out having your scans, but then also being moved to a longer period in between scans also has its own level of anxiety as well. So yeah. I think that that's exactly right. What we hear too is, there's always the big changes and sometimes even the positive changes are really, really difficult to handle and maneuver through.
What is something you think overall just the average person would be surprised to find out about kids and families in this time frame of their journey?
I think that once everyone else hears that the treatment has ended, last day of treatment, ringing the bell, there's a lot of celebration that happens around that time, make a wish, all of these celebrations, positive celebrations, excitement. And I think that everyone else doesn't always realize or would be shocked to hear that there's actually a lot of grief that happens after this as well. You are grieving who you used to be. So for a lot of kids and teens, whatever they used to be like is different now.
Yeah.
And they're still trying to figure out what that's going to look like moving forward. Lost my train of thought there, so we might have to pause. Could you repeat the question one more time?
Yeah, absolutely. What is something the average person would be surprised to find out about kids and families in this time frame of their journey, like you're saying, when they finish treatment?
Yes, so a lot of mixed emotions. I think I mentioned grief. There can also be a lot of sadness involved there. Milestones that the child, teen, or young adult missed out on because they were in treatment. There's also so much isolation that happens during a cancer journey and treatment journey that kind of re-immersing into a social role and a social world can often be really anxiety-provoking and overwhelming. So I think that those are some of the main pieces that we don't really think about because we're so overwhelmed with happiness and so excited for these individuals. It can often be strange or shocking to hear that they're still struggling, or they may still not find their footing for quite some time afterwards.
Yeah, absolutely.
And there's that the difference in perception, right? Between maybe everybody around you thinking, okay, it's over, you're done, you're through it. And then still having the anxious feelings, still going through very much a grieving process must be make you feel so off kilter, right?
Yeah. And I think the expectation, like you're mentioning, the expectation is it's over, we should be so happy. When we're not feeling that way, it's almost like, was there something wrong? Should I be feeling differently? Why am I feeling this way? Why is this happening if everything is quote unquote better? I think a lot of people also don't realize or may find shocking is that there is so much anxiety that comes afterwards. There can be a development of anxiety for just doctor's visits in general, a lot of health anxiety, even if it's outside of the scope of cancer. It can just be anything wrong with health, getting a fever, getting sick again. It can bring back a lot of those memories and those experiences through the cancer journey and the treatment journey that then affect them moving forward. So there's so much to process just to move forward into this next phase of life.
And would you classify some of what you're talking about as I think people who might be listening would maybe think of survivor's guilt as being something that they could imagine someone would be going through. I feel like you're talking about a little bit more than just that, but it sounds like those are the thoughts and feelings that you're helping the kids process through quite a bit.
Yes, there is a lot of survivor's guilt. I've had some patients talk about connections that they made throughout treatment, and sometimes they keep in touch, sometimes they don't. But I think just that exposure changes their perception into seeing that other people don't make it.
Right.
So that taps into that survivor's guilt. And I think just not knowing, again, kind of finding this new role. I am one of those people that gets to move forward, but what does that even look like? And even for our populations where there could be a cancer recurrence. So again, we're really excited because this cancer journey ended, but for some, depending on the diagnosis, depending on the treatment they had, there's so many different factors, it could come back.
Right.
It could also create a risk factor for developing another type of cancer later on in life, even in adulthood. So again, that anxiety, that fear is always in the back of their minds.
Yeah. We talk a lot about the isolation our families feel and that they tell us about, and you've hit on that a few times too. And so I think what it goes to is then for our listeners, what are easy ways people can help a family or just be there for a family that's going through this? And maybe you could talk us through some ideas there.
Yeah, I think that's really important. It's almost, I think one of you was mentioning this earlier, where we kind of forget because everything's over. So I think the check-ins stop. And how are you really doing? Some of those questions diminish over time. And I think something that could be really helpful is to continue doing those things. check in regularly, ask questions about, I feel like as a society that, hey, how are you? Great. How are you? There's always kind of this automated response to say that we're fine. Even
Yeah.
if
You're great.
yes, exactly. Great. I'm doing great. And there's a dumpster fire going on. But asking, how are you really doing today? Or being really specific. How are you doing with coming back into school and seeing people in person again? How are you feeling about, going back into sports when you haven't been active in so long? How are you feeling about going to this birthday party? And then asking how you can be supported. How can I support you? Is there anything I can do to help you feel more comfortable in this specific setting or situation? Specifics, I think, are really helpful. I also think that oftentimes we don't have the answers. So when people ask, how can I help? What can I do? They may not always have answers. We may not always know how people can best support us. Sometimes even offering, do you want to talk about it? Do you want me to just listen? Do you want me to distract you? Let's do something fun. I think that those are some great options to throw in there too, because you're helping that individual develop their voice, understand what their needs are, and kind of helping them learn to advocate for what those needs are.
And that you're a safe person that they can come to with that.
Yeah. I love the idea of being specific too, because I think sometimes your thought is, well, I don't want to bring up that it might be awkward for them to go to sports. And it's like, oh, they've thought about it.
Right. Yeah.
Like they haven't, none of these are going to be new thoughts. So I think it's really freeing, or it's very empowering to hear like, yeah, help them know that you're thinking past that treatment phase and into that moving back into survivor phase, and that you understand there's still something there. And maybe they are really excited to go back to sports, but that opens the door to, but actually about this other thing, I know I could come to this person now.
I think that also speaks to a little bit how we can show up for families whose child didn't make it, right? I think we tend to tiptoe around one, like, should I bring up the loss of their child? They remember.
Yes.
They remember, number one. And I have found most times that people just want to know that they can still talk about their child. And so bringing them up, asking how they're doing, but also just, helping them, sharing a memory that you have of their child, I think helps them be connected, or just, just saying their name a lot of times is just so valuable for the families. And I think we are all like, oh, well, we don't want to upset them. They've been through so much. And it's like they know, and it's harder, or as hard. It's so overwhelming to have to, then they're also worrying about making you feel uncomfortable.
Right.
So let's just say their name. Let's talk about it. Let's get involved. Let's do something, whatever you're comfortable with, but allowing them the chance to connect.
Yeah, absolutely.
Yeah, I think that's a really good point. There's it's almost taboo to bring up trauma or loss.
Right.
When in reality, the only way we really get through it is by acknowledging that it happened in the first place. So other people in our lives can really help with that journey and that progress and that healing by acknowledging. We don't want to forget and dismiss something that happened.
Right.
Giving the person the opportunity, if they don't want to talk about it, they can tell you they don't want to talk about it. I don't really feel comfortable talking about that. Or I would really love it if, we just didn't bring it up. Then But we want to acknowledge and ask, and also take some initiative, maybe even in suggesting plans or suggesting a get together or just coming over to hang out. I think a big piece of this too is that with any healing journey, there are some good days and bad days. There can be days where someone can seem totally fine. They're going to school, they're going to sports, they're doing everything that they need to do, but we don't know how they're feeling on the inside. And there may be certain days where they're not feeling great, maybe socializing or doing a really big event or something that requires a lot of physical energy, because that's also affected post-treatment. Let's scale it back and meet the person where they are, giving some options and some different ideas, a variety of activities. I can come over, let's go watch a movie in the house, make some popcorn, or, let's go to the mall, let's go do something else outside. That can really help as well.
And I think one thing we find a lot is people want to know or are confused or nervous to talk to their kids when another child has cancer. And it's hard, right? You want to be able to make sure you're engaging with them on their level. But when we don't have those conversations, now everyone is taking a step back and isolating. I didn't know if you had a couple easy ways, perhaps, to talk to kids about if a friend has cancer or is just done with treatment, but I think both sides of that.
Yeah, that's a really great topic. Books are really, really helpful. So depending on the age of the child, something that's developmentally appropriate for younger children, picture books or story books. There's so many great books out there now that talk about when a loved one is sick. And that could be, friend, family member, etc. But just having those conversations, you can read the book, have the child kind of understand what this looks like, and then talking to them about it afterwards and explaining, this is similar to what this person is going through in your life. And at the very basic, just saying that someone isn't feeling well and they have something going on with them that could last a long time or a short amount of time, or it's visible, it's not visible.
Mm-hmm.
And they're going through treatment, something that's really tough on their bodies, but is going to make them better, or it's trying to make them better, make the illness go away, make it go away completely, etc. However that fits into the unique situation. But those are some ways that families can really talk to them about.
That's great.
That's great advice. Because I think that's one of those things, right? That it's the topic that you want to help usher your child through is, the topic is whatever. For a parent, it's really hard to explain the truth to your child, but also not scare them, right? And that's what I think the baggage is that parents, we can take into those conversations, which is everything I know about cancer doesn't have to be everything that they know about cancer. They just need to know the information that helps them understand a little bit what that person's going through and show some empathy. And I think that's probably a little bit more understandable for folks. Like, oh, I can do that. Like, that's just like any other hard topic that we talk about in our family.
Yeah, absolutely.
Yeah. And I think a last piece there is if a parent is talking to a child about their friend who is going through this, depending on the unique situation, they can also tell them when they're going to see them the next time or visit or take them something, what they may expect. Because physically, things can look different when we're in treatment. Again, I know that it's treatment specific, but sometimes we have hair loss. Sometimes individuals lose weight. Sometimes they get some discoloring because they're not outside as much. They may look really tired. They may not have a lot of energy. So having those conversations with children, almost prepping them before so that there isn't that kind of clashing interaction where you see someone and it's just not how you remember them. But having that conversation about this is what you'll expect and this is why, or the medicine makes them feel this way, that kind of language can also be super beneficial.
What a great tip. It wasn't even something that I was thinking about. But yeah, the child going into that scenario, just thinking that I'm going to see my buddy I remember what we did last time we played together, and it might just helping establish those expectations and sort of helping them through that is such a great tip. I love that.
Yeah, absolutely. Well, can you tell us a little bit about where people find information about your clinic?
Yes, absolutely. Google.
Yes.
Google is our friend, but just kind of any search engine, we can put AdventHealth Medical Group. So these are a lot of the outpatient clinics or specific practices related to AdventHealth and neuropsychology. You would see a couple practices come up, and ours is the pediatric clinic.
Awesome. Well, can you tell us a little bit about what are kids facing when they leave treatment?
So they are facing adjustment to changes in a lot of different aspects of their lives. So if we're just thinking about the physical, there can be physical differences in their appearance. That comes with its own challenges. Their energy levels or stamina, being able to do maybe what they did pre-treatment. It can also, depending on the treatment, depending on the type of cancer, where it was, all of those different factors, it can also affect their fine motor and gross motor abilities. So thinking about children who might have been really active in sports, that may not be something that they are able to do immediately after. And it may be something that meets with challenges later on. It really is situation specific. Another piece is cognitive changes. So again, what type of cancer, where it was, did we get surgery to have something resected, something taken out? Where was that in the body? What could it possibly affect? So sometimes kids go back into school, maybe even in-person school because they were virtual previously, and their learning is different. Their attention, memory, all of these things, even speech in some cases can be impacted, unfortunately, due to treatment and everything that comes along with it. So if we're thinking about academics, that could change. What that looks like before may not be what it looks like now, and moving forward, they may need some accommodations moving forward as well. And then I think, again, just the social piece is finding out, where do I fit in now? And how can I just be a kid? How can I just be a teenager? I think a big piece of treatment, kind of the counseling portion of treatment, is helping them connect with what they enjoy. How can we reconnect with those things we really liked? What do we want to do moving forward? What are some goals we have? If we miss some milestones, are there any opportunities that we can still celebrate that somehow? Even if it's not in the traditional timeline, we're getting our license a couple years later than everybody else. We're still getting our license. We're still, able to have that freedom and that independence. So I would say that those are the big ones that we see.
I think it's so great. Clearly you care so much about what you do, but you're so thoughtful in these pieces that it's easy for, I think, an adult to go, but you're here, you're alive, and it's so great. Who cares? You're here. It's like, these are wonderful things that we've still, to this day, everyone talks about as an adult, when they got their driver's license. Although I failed my driver's test the first time, it's like such canon events of your life. And to be able to point out that it's okay to be disappointed, even though you survived, and then how do we rebuild that piece of life is really, really beautiful.
Well said.
Well, and so overall, truly, the whole reason CKC exists and why we invest in innovative research is to make life and these treatments easier for kids and their families, so they can go be normal teenagers and they can go grow up to be adults. So for our listeners, if you want to support research, you can make a gift on cannonballkidscancer.org. And also, if you're interested in learning more about the research we fund, you can click research and learn more there as well.
Join us as we transform fear into courage and turn adversity into opportunities for change.
If you want to be involved in the conversations that create change in the world of pediatric cancer, take a moment, share, like, and subscribe.